in the normal sense, the state of pregnancy gives you a diabetogenic state. Why? Because in the first trimester, when you're in the first trimester, what is then going to be happening is that there is going to be increased sensitivity. Okay, this is increased insulin sensitivity. Why is there increased insulin sensitivity? It means that we will need this glucose here to be stored into the reserves. So this glucose will be stored for future use. So it will be stored in the reserve. So within the first trimester, you have high insulin sensitivity, which will get more of that glucose from the carbohydrates that are being taken, so that they are then stored in the reserves. After getting the glucose into reserves, you notice that as you move towards the second trimester, there is going to be an increase in the hormones. Okay, now an increase in the level of hormones. You have human placental lactogen here. You're going to obviously have estrogen also coming into play. You're going to have hormones such as progesterone coming into play. You have hormones such as cortisol coming into play. You have also the growth hormone coming into play. So these hormones are going to be in higher amounts. Now, when they are in higher amounts, these hormones are actually insulin antagonists. So what they will do is that they will fight the activity of insulin. Insulin in the first trimester had a raised sensitivity. But when the hormones start raising and coming up as you move towards the second trimester, what is then going to be happening is that these ones, they will be stopping the insulin sensitivity and reducing it, meaning that they will be increasing insulin resistance. So these hormones here are the ones that then stop the insulin from utilizing much of that glucose and storing it into reserves. As a result, there will be more of that glucose that will be circulating in the blood, but it is not being used, or it is not being stored into the reserves. So when we do a blood test, then we'll find that your blood sugars have actually gone up, because the hormones here have stopped the insulin from utilizing up that glucose. And then you enter into a state that we are going to call a diabetogenic state. Now, when you get into a diabetogenic state, if that is not regulated well by the body and it is continuous, then it means that your levels now will go beyond the required 4 to 7 millimoles per liter, and then you get into a stage of now diabetes.